Sjogren syndrome or Sika syndrome. Let's talk about an interesting case that I recently came across. A lady in her 30s came to me complaining of severe dryness in her mouth and eyes. She also felt a need to rub her eye, as if there was something in it. I noticed her speech was unclear. She had dry, cracked lips with bilateral erythema at the angle of her mouth. The right side of her face was swollen, and the right earlobe was everted. I immediately suspected a parotid gland enlargement. She casually told me the swelling was not always present, nor was it painful. So here the two complaints that caught my attention were dryness of the mouth called xerostomia and dryness of the eyes called xerophthalmia. These two complaints were reason enough to suspect a condition called Sjogren syndrome. This condition is a chronic, systemic, autoimmune disorder. The dryness of the mouth and eyes indicates reduced secretions of the salivary and the lacrimal glands. Sjogren syndrome can be primary, where only these two glands are involved. However, when associated with other underlying autoimmune disorders like rheumatoid arthritis, scleroderma, and SLE, it can be called secondary Sjogren syndrome. Women in their perimenopausal or postmenopausal stage are commonly affected by this condition. Let's go back to the clinical scenario. I asked the patient what her main concerns were. The dry mouth resulted in difficulty speaking, swallowing, and tasting food, leading to dysgeusia or hypogeusia. She constantly felt the need to sip liquids throughout the day and woke up at night feeling thirsty. Now, how does reduced saliva secretion affect the oral cavity? Lack of salivary pooling in the mouth causes pain and a burning sensation in the oral mucosa. Deep papillated or fissured tongue causes glossodynia. Lips will dry out and crack. The minimal saliva present would be thick and ropey. Secondary fungal infections, such as mucocutaneous candidiasis, take over the oral cavity, leading to erythematous, tender mucosa. This causes angular cheilitis and denture sore mouth in edentulous patients. Lack of saliva deprives the teeth of the natural cleansing action they get, leading to caries, especially on the roots, facial surfaces, and cuspal tips. Salivary stasis leads to gland infection and subsequently enlargement, seen in 20 to 40% of patients with Sjogren syndrome. The swelling can be unilateral or bilateral, intermittent or persistent, and non-painful or slightly tender. Moving on, how does reduced lacrimal secretion affect the eyes? It causes a condition called keratoconjunctivitis sicca, wherein the word sicca means dry. Patients typically feel a sandy or gritty sensation in the eye, as though a foreign body was present. In severe cases, it becomes painful with blurry vision and mucoid discharge. Let us understand the reason behind the mucoid discharge. The layer over the cornea is called the tear film and is further divided into three: the lipid, aqueous, and mucin layers. The lacrimal inflammation will cause a decrease in the aqueous layer, but the mucin production will still be the same. A simple way to confirm decreased tear secretion is the Schirmer test. Here, a strip of filter paper is placed right over the margin of the lower lid. The portion of the filter paper that gets wet is measured to assess tear production. Values between 0 to 2 mm confirms a dry eye state. Apart from all the mentioned signs and symptoms, dryness can also affect the skin, nasopharynx, throat, trachea, and vagina. Patients may experience fatigue, arthralgias, myalgias, peripheral neuropathies, and rashes. To confirm my suspicion and differentiate between primary and secondary Sjogrens, I proceeded with the investigations. First, I asked for a blood test to be done, specifically the anti-nuclear antibody test, or ANA, and a test for the RA factor to rule out rheumatoid arthritis. Now let me explain why I did this. Our immune system is like the police force. It protects us from criminals, but sometimes innocent people are accused of the crime. Similarly, the T cells of our immune system can attack normal cells, mistaking them to be foreign bodies. This is what happens in an autoimmune disorder. In the case of Sjogren's, specific autoantibodies like anti-SSA or anti-RO and anti-SSB or anti-LA are released to fight against the antigens. The blood test confirmed a positive ANA result but negative RA, which confirmed primary Sjogren's syndrome. Apart from this, the blood report also showed elevated ESR and serum IgG. My next step was cyalography, a diagnostic imaging technique that revealed a fruit-laden branchless tree pattern. A biopsy of the minor salivary glands from the lower lips is the ideal test to confirm Sjogren's syndrome, but most patients are reluctant about it. Now let's move on to the management of Sjogren's syndrome. As an oral practitioner, supportive management is my only approach. I prescribed artificial tears for the dry eyes and secretagogues to stimulate salivary flow. Secretagogues are of two types. Non-pharmacologic ones such as sugar-free gum or sugarless candy, and FDA-approved secretagogues like pilocarpine are recommended at a dosage of 5 mg up to 4 times a day and 7 30 mg thrice a day. Salivary substitutes are also available in the form of lubricating gels, mouthwashes, lozenges, toothpaste, and oral sprays. I advise the patient to avoid medicines known to cause xerostomia and prescribed antifungal agents for candidiasis. This brings me to the end of my clinical scenario. Thanks for watching. Hope you had fun learning with us.